gracious. Hello, hello. Hello, my friends. Jill Osborne from the Interstitial Cystitis Network. It is Sunday, January 28th. It is time for another live support group meeting. My purpose in doing these meetings is to make you so strong, so knowledgeable, so informed that no one can mess with you again. I don't want anybody telling you that you're damaged goods. I don't want anybody telling you that this is your fault. I don't want anybody telling you that you will never get better. Baloney. Baloney. So, for those of you who don't know me, now what's so interesting about these meetings is I realize now, and I get lots of phone calls, emails from people who watch the meeting after the fact. And I certainly expect that today, because today here in the United States is a big football day. And so that's really quite exciting. Go 49ers. Okay. So for those of you who are watching after the fact, please know that you can always reach out to me if you have questions that you'd like me to answer. You can always email them to me at icnetwork@math.com. The big thing that happened this week is that all of my windows were replaced. This office was empty. There are two big windows in here. And so we're doing lots of cleaning, got some new plants, and trying to reset stuff up. Sometimes it works, sometimes it doesn't. It's always a bit of an adventure. If I'm looking here, I'm looking at Facebook. If I'm looking over here, I'm looking at YouTube questions. All right. Now, normally when I do these meetings, I will do a little intro, educational intro, and then we'll take your questions. We will go as long as you want me to go. If you want to cut out early, that's perfectly fine with me. Anne says, can you have burning without a UTI and flaring? Absolutely, Anne. Absolutely. Especially if you have estrogen atrophy. If you're bladder wall driven phenotype 2 estrogen atrophy, then yes, you are going to have burning without a UTI or without flaring. That usually speaks to the quality and health of your skin. We're going to see a lot of burning in the urethra, on the vulva for women who are struggling with estrogen atrophy. Let's see here. Let me check one other thing here. And I think too, we have to assume that everybody's online watching, and I think that's why the internet's probably funky. Okay, so while I was doing my cleaning, I found, and here, hold on a second, let me move this over. Y'all don't need to see my mess because there's still mess back there. I found a little gem. A little gem. You know, we have to learn, and we have to acknowledge those doctors and activists who early on were right. They might have been ignored, they might have been laughed at, but they were right. One of those doctors in question was a doctor named Dr. Stanley Antelak. And Dr. Stanley Antelak, back in the late 1990s, was talking about pudendal neuralgia. So remember, we do phenotyping. We need to try to identify the underlying cause for your pain. We don't just want to treat symptoms. We want to identify and treat underlying cause, whether that's estrogen atrophy, whether that's UTI, whether that's pelvic floor dysfunction, etc. As we do our phenotyping and we try to figure out which group you're in to try to find out what is the right treatment for you, there's a symptom that we always have to be attentive to, and that is symptoms that change with body position. If you get worse when you sit down and you get better when you stand up, that's a biomechanical issue. That's a muscle issue. That's a muscle and nerve issue. If you have pins and needles, if you have areas of numbness, if you have sciatica, where you have pain that shoots down your leg, those are perfect examples of muscle squeezing nerves. I suffered with this for years. Because remember, for me, my symptoms started in junior high after I broke my tailbone. Of course, we thought it was my bladder for 30 years. Bladder therapies never worked. But once I was in my 30s, I started having trouble sitting. And I started having more and more pain when I was sitting. When I started the IC network, I could sit here for 10, 12 hours and program and write articles on IC. I got to the point by the end of my 30s where I could only sit for 10 to 15 minutes before I had searing pain. Why? Why? Because up to that point, nobody had really looked at the role of muscles in causing IC symptoms. And what was happening is my muscles were just getting progressively tighter and tighter and tighter. And as they got tighter and tighter and tighter, they started squeezing nerves. Now, the blessing here is that I don't have that so much anymore unless I sit for a long period of time. My phenotype is pelvic floor driven. Hello, Ariana's mama. You're having a urodynamics in March, Botox in April, also doing pelvic floor therapy weekly. Excellent. Glad you're doing the pelvic floor. Excellent, excellent. Now, you guys, if you have questions, go ahead and ask them. It's okay. So anyway, Dr. Stanley Antelak, who was up in Minnesota, he didn't work for the Mayo Clinic, but he was very close to it. It was really only one of two doctors at that time who were working on pudendal nerve entrapment. And I found his self-care guide. And I wanted to read it to you because I think it's very, very insightful now that we know what we know today. Listen to this first sentence. Chronic pelvic pain is a boundary disease affecting urology, colorectal, gynecology, physical medicine, neurology, and other specialties. When sitting aggravates or causes the pelvic pain in the perineum, genitals, coccyx, rectum, or pubic hair, we suspect pudendal neuralgia, often called pudendal nerve entrapment. Pudendal neuralgia is considered in all men and women with pelvic urogenital pain with or without bladder symptoms or sexual dysfunction. A simple definition of perineal pain: aggravated by sitting, reduced by standing, not present when recumbent, and generally relieved when sitting on a toilet. So when you're sitting on a toilet, there's nothing pushing up against those fragile muscles and nerves, right? The striking common feature in pudendal neuralgia patients is that flexion activities of the hip, sitting, climbing, squatting, cycling, and exercises induces or aggravates urogenital pain, chronic pelvic pain, and prostatitis-like pain. Many male patients have played American football, they've lifted weights, or they wrestled as teenagers or young adults. And often females were active in high school athletics like gymnastics, dance line, or cheerleading. I was working with a cheerleader who was a cheerleader for 13 years, and her pelvic floor was absolutely toast because she was doing flying splits. So flying splits is where you jump up, you spread your legs, and you land directly on your crotch. Imagine the toll that took on her muscles and nerves over time. Our primary hypothesis is that hypertrophy of the muscles of the pelvic floor during the years of youthful athleticism causes elongation and posterior remodeling of the ischial spine. A posterior and medial shift of the ischial spine leads to juxtaposition of the sacrotuberous and sacrospinous ligaments that are normally separate at their insertions into the ischium. This change results in what they call a lobster claw, two ligaments that can compress the pudendal nerve. Now, I know that that's a little advanced there, but again, we're talking body mechanics, and we're talking about what the big risk factor that we see over time is a history of childhood athletics. So for me, I was actually a very chubby kid. I was a TV baby, kind of like the internet babies of today. So back then, I was a TV baby.
And then I got scoliosis, and I think that was because I was just chubby, and my family with very, very big breasts. I grew, my muscles and my spine could not support the weight, and my spine twisted. Um, Once that was found, my goal here was to take off the weight, which I did, and try to repair some of that damage that had been done. Okay, so self-care. So what do we do about it? What are you patients supposed to do when you have pudendal nerve entrapment? The goal is to stop irritating the nerve. We have to decreasing the neurotransmitters to the spinal cord lets your pain decrease. The other secondary problems will gradually improve. This novel but more remarkably effective self-care was based on the observation by the French that sitting on a toilet seat relieved the pain, and by our continuing observations of exercise-induced pain. Therefore, treatment is to sit with the weight of the body supported on the ischial tuberosities, which are the sit bones, with the perineum suspended to relieve pressure on the ischioanal fat body against the nerve. In other words, we just don't want to push anything up into the nerve between your legs. Cessation of flexion activities is extremely important. Okay, hold on. I can quit that part. So what they did, one of the ways that they diagnosed this is they had patients sit on two parallel paperback books, one under the left butt cheek, one under the right butt cheek. And they studied 600 patients. And what they found is reduction of pain in only a few minutes can be dramatically effective in over half of the patients. Over a period of time, this technique can cure pain, bladder irritability, and sexual dysfunction. Okay, so what to do? Number one, do not sit down if it hurts. Do not sit down if it hurts. If sitting is necessary, make a perineal suspension pad. We have these chair cushions in our store, but I'll show you how to make it too if you want to. The concept is to sit on a pad that supports your body weight by the sit bones to suspend the perineum, thus relieving pressure from the pudendal nerve. Using the sitting pad at work, in your car, at church, at home, and in restaurants. An alternative is to tuck a small book under one sit bone to lift your perineum slightly. One businessman used a leather folder with two tablets. He left it on his chair prior to sitting and tucked it under one sit bone. And he said, if necessary, stand to use your computer, read the paper, do office work. Now, as you can see, when I do these meetings, I can sit like last Sunday, I sat for 5.5 hours. But as soon as I start feeling that nerve getting funky, that's when I'm going to start moving around, because it makes absolutely no sense for me to continue to damage that nerve. That sitting and that muscle squeezing that nerve, those ligaments squeezing that nerve, will only damage the nerve more. We have to be very, very attentive to what makes the nerve hurt. One of the things that patients struggle with, for example, speaking of football, is if you go to like a high school football game and you sit on the bleachers, it's hard. The odds are you're not going to be able to sit on those bleachers. You're going to need to bring a chair cushion that will, again, suspend your pudendal nerve. And let me show you that chair cushion. I've got it right here. Okay. This is the bomb. This is our best chair cushion by far for anybody with urethral pain, prostate pain, bladder pain, pudendal neuralgia, clitoral pain, etc. You can see when you sit on this, each butt cheek is supported, but there's a groove down the middle so that you're not pushing directly up into that nerve. So he basically had his patients cut way back on activities that we know can irritate the nerve. So he said, no squatting, no cycling, no Stairmaster. I'm done. I love Stairmaster. I can't do it now. I shouldn't do it now. No exercise cycles, no weightlifting, no bowling, no ab crutches, no step aerobics, no skiing, no sit-ups, no jogging, no spinning. And you should avoid climbing stairs. Use an elevator or escalator whenever possible while we're trying to rehab this muscle and nerve injury. He says, here are the results. We've demonstrated statistically significant improvement in pain and bladder symptoms. And so here are a couple of testimonials. So this is from a gentleman who said, I suffered from chronic prostatitis for many years, went through all the usual treatments with no effect at all. Then I happened to run across an article by Dr. Antelak at the Department of Urology in the Mayo Clinic. I'm now convinced that my disease was biomechanical in nature and not organic. I have been pain-free for a while now, and I suggest others may benefit from the simple free treatment advocated by Dr. Antelak. And the highlights of his article are 90% of the men with prostatitis are considered to have category 3 non-bacterial prostatitis. Pudendal nerve entrapment is frequently identified as the basis for the symptoms of prostatitis. Treatment consists foremost of perineal hyperprotection, the punctilious avoidance of sitting and cycling, and using special seating pads. You spare the perineum from pressure is often curative. I hope this information will prove useful to other sufferers. And that was from a guy named Dave. Okay, so here's something from Teresa. Today is my 3rd week back to work. It's a May 8th or 9th. I have no pain. I can't believe it. I wake in the morning and expect to feel that old feeling, and it's not there. I'm really delighted. Oh, that's actually from Rosemary. Here's Teresa. After 10 years of pain and 5 years of irritable bladder, this self-care program has relieved my problems almost completely. I have no pain. I can sit in a car plane for over 3 hours. I can eat at restaurants, drink any type of juice without irritating my bladder. I do not have pain during or after intercourse. I want to reduce my amitriptyline to 5 milligrams at bedtime. And this was after being diagnosed with pudendal nerve entrapment and following these basic self-care techniques. Here's another one from a man. I drove from Michigan to Daytona Beach in December and returned in February. I had episodes of tailbone pain during the trip both ways. It lasted 1 to 2 days both ways. I did not have bladder or prostate pain or rectal pain with the travel. I did use the special seat consistently during driving. I take 1/2 of a 25 milligram amitriptyline at night. I feel that I have more penile sensitivity and can ejaculate without pain. Life is good. The treatment has changed my life. And here's one more. On June 27th of this year, and obviously this was several years ago, I visited your clinic regarding chronic prostatitis. Since our visit, I have followed your 3 suggestions. I stopped riding my Airdyne cycle. I stopped lifting weights. I purchased and used a gardener's pad with the center section removed. I've had 0 pain in the prostate area. It's wonderful to not be taking Bactrim, an antibiotic, and to be pain-free. And so this is before we have these new chair cushions. So what he told patients to do is to buy a gardener's pad, just a simple foam gardener's pad, and then to cut a groove down the middle. So again, each butt cheek is supported, but nothing is pushing up against that nerve and damaging that nerve further. And so ultimately, sometimes, Karen. Hey, Karen. Karen says, I'm having a bilateral pudendal nerve block tomorrow morning. Girl. Wow, let me know how it goes. That's going to be fascinating for you. Absolutely fascinating. So again, cause versus effect. Cause versus effect. We're not assuming everybody has a bladder disease. We now realize that a lot of IC symptoms are neuromuscular in origin, and in many cases, it's the result of childhood athletics or traumatic injury, such as an injury being hit by a car, falling on your tailbone like I did, or having a difficult labor and delivery where your muscles may have been injured that way. So again, to summarize, if you have positional symptoms, if your pain gets worse when you sit down and it gets better when you stand up, that is not your bladder. That is your pelvic floor. That is muscles and nerves. If your pain is not centered, if it is to the left or right of center, that is your muscles and or nerves. And as I was talking to another IC patient yesterday, it's really easy to get lost in the diagnosis. Okay, I've got interstitial cystitis. I've got irritable bowel syndrome. I've got vulvodynia. I've got endometriosis. I've got this. I've got that. And before you know it, you're just piled. It's like you're wearing a sandbag for each disease. You're just piled on. And it gets very confusing, especially as you're trying to figure out what causes what. And I think it's sometimes if you're at that point where you're very, very confused, go back to the fundamentals. Pain is coming from muscles and nerves, organs, or skin. Your skin is an organ. It's that simple. And the connection between IC and IBS and pudendal neuralgia and any of these other chronic pain conditions like TMJ, etc. The connection is muscles and nerves. And so we have to focus on muscles and nerves. And I know it's going to be really tempting to put all of your money into supplements and or treatments, but you have to ask yourself, am I getting better or is there room for improvement? If you're still flaring, despite doing rescue installations, despite being on antibiotics, or despite being on antidepressants, etc., you have to ask yourself why. Because you're chasing symptoms. You're chasing the symptoms. And what our national guidelines say is if you're not responding to treatment, if you're getting worse rather than better, stop what you're doing, take a step back and revisit the diagnosis. We don't need to keep doing things that aren't working. And in fact, our guidelines specifically say, don't do that. If it's not working, don't do that. Let's not throw that money away. And for the great majority of patients who have done bladder installations and Elmeron for years and years and not gotten better, the reason why is because fundamentally it's not their bladder, it's their muscles and nerves. Kayleen says, they definitely feel like the sandbags reference. Exactly, girl, definitely. Ariana on YouTube says, I'm working with the University of Wisconsin Neurology, and they're fantastic. Excellent. Mame says, up and working fine here now. Excellent. Donna says, hey, girl. Nice to see you, Donna. Well, I said, hey, girl. You said, hi, Julie. And everybody watching. Okay. Do you guys remember over a year ago, I had my teeth cleaned, and they broke the roots of 2 teeth. And I'm wearing a flipper right now. That hurts. They made them too small twice. And now I have to wait another month to get them. And so if it sounds like I'm not speaking clearly, and hold on. I'm just going to take it out because it's driving me crazy. Hold on. Okay. If you see missing teeth, that's why. Not my fault. A brand new hygienist did it. She broke the roots of 2 teeth. I can talk now. Yes. Okay, so I'm just going to be slightly tilted this way so that you can't see the missing teeth on this side. Okay. So Anne says, what can I do for coxidynia? Thought I had pudendal neuralgia and I do not. The same thing, honey. It's the same thing. Coxidynia means your tailbone hurts. The nerves are sensitive. So number one, you have to protect the tailbone. Sitting on one of these chair cushions or making your own is critical for you. We have got to reduce weight bearing on that tailbone to give those nerves an opportunity to calm down. It's that easy. Maybe you might need to. It depends on how it's presenting. If you're having areas of numbness or pins and needles in your skin, they might give you a topical lidocaine. If we've got kind of a more structural issue, your tailbone's broken out of position, you might need to work with a physical therapist and a chiropractor to try to restore its correct position. All right, let me scroll back here. And you guys, if I miss a question, please don't take it personally. It just means I missed it. Ask it again. Be the squeaky wheel. For those of you who talk to me regularly, I always say that. Be the squeaky wheel. You can ask over and over again. Marianne said she could see and hear. Yeah, but it was on the wrong camera, Marianne. That was the problem. That's why I kept having to stop and start it. Hi, Susan. And let's see. Paola says, I went to see the new urogynecologist. He seemed more knowledgeable about IC than my current urologist, but he thinks I'm not in perimenopause like my urologist said. He said the estradiol is not needed, but if I feel better, I can still use it as it was recommended by my current urologist. I was telling him the estradiol and the fesoterian helped me a lot, that I was feeling way better than when everything started. The new one recommended IC diet and control my stress. And he said, maybe later on, I can look into physical therapy. He also prescribed Urabel. I think I will stay with my current urologist because I do think the estradiol and the fesoterodine are helping me, even though I still have normal menstrual periods. See, the thing is that estrogen levels will gradually diminish over time. And if you're on birth control, that's going to diminish estrogen levels. That has a chance of triggering a more weakness vulnerability in the bladder wall that can cause some of these symptoms. And topical estrogen is considered remarkably safe in the research studies that have been published in the last 5 or so years. For those of you on Twitter, you want to follow Dr. Rachel Rubin. Rachel Rubin, Rubin, and also Dr. Ashley Winter, and also Dr. Jennifer Gunter. They're excellent on the use of hormones. Peggy said, I had a bladder ultrasound last Monday. They found a coarse stone in the, wow, girl, they found a bladder stone. I go for a CAT scan on February 5th to see how big it is. Then from there, a urology surgeon to get it removed. When I first called you last April, I thought it was in a real bad flare, but now I'm thinking it was all about the stone. Hopefully, this is what is causing the extra pressure I have been having since. I pray to God that this pain goes away after I get the stone out. I was always able to control my flare-ups for up to 22 years. I knew that this was different. Hope you're well now. Yeah, I'm better now. My throat is still a little tight, but I'm better. So Peggy has a bladder stone. Let me get you a picture of a bladder stone. Hold on. So bladder stones can occur if the bladder has been badly injured, or if you're not well hydrated and your urine is so concentrated that the minerals are basically just crystallizing out. It's taking the minerals out of an aqueous suspension and they're making crystals. So here is a picture of a bladder stone. And he actually has several. Here, you can see here. Now, for this gentleman, his bladder stones were the result of many surgeries. He was a surgical injury patient, not a typical bladder disease patient. He had to have many surgeries to try to repair some damage done in prostate surgery. He was left with gangrene in his prostate, and it took them a while to find it after the surgery. Anyway, with the last surgery they did, they left a bleeder in his bladder, And they sent him home, and his bladder filled up with blood and filled up with blood clots. It became an emergency. He goes back to the ER. They sent him into the operating room, and literally there was so much pressure in his bladder, it split in two pieces. It split in two pieces. And they had to sew it back up. And the bladder stones came out of that surgical wound because that was the site of this very, very severe injury that disrupted normal calcium metabolism processing, something like that. It's not happening now, but sometimes that happens after a bladder injury. But Peggy, the odds are for you, it may have just been you were traveling, you just weren't drinking enough water, et cetera, et cetera. Maybe you threw a small kidney stone, it didn't pass through, it stayed in your bladder for one reason or another, and it just got bigger and bigger. I worked with another patient, same exact thing. They basically broke up the stone, got it out of her, all of her symptoms went away. And I truly hope that that happens for you, hon. This is very, very exciting for you. Congratulations. I'm really glad that they found that. Kayleen says, can you keep us updated? I'm having a nerve block, except it's for my clitoris. I'm so nervous. Yeah. Absolutely, girl. And okay, let's see. Keiko says, I'm wanting to learn more about this. I do have Hunner's lesions and inflamed SI joints, but I've been having more and more pelvic pain as well, especially while sitting. I'm starting to wonder if this is part of my issue. What doctor does this nerve block? How long does it last? You want to go to a physiatrist, because if you're having SI issues, your muscles are involved. And so all of your muscle dysfunction may be triggering all of the other symptoms that you're having, from your bladder symptoms to your Hunner's lesions, etc. You know, the legacy of tight muscles is it restricts blood supply. Your bladder is supposed to get 24 units of blood a day and it's only getting 10. Are you going to have a healthy bladder wall? No. But the inside that, not only is the bladder deprived of oxygen, so are the nerves. The nerves need good, healthy blood supply to be healthy. And if the nerves don't have good, healthy blood supply, what happens is they start to become very, very, very inflamed. So we have got to restore proper blood supply with really good physical therapy. Look at that. My mic just started working. Okay. So a orthopedic surgeon, a sports physical therapist, or a physiatrist. A physiatrist is a doctor who specializes in muscles and nerves. Mary says, I'm having a hydrodistension with my Hunner's lesions, having steroid injection, but there is a possible biopsy. But is there something I should ask her to test for? No. No, we just need to get a really good look at your bladder. And if they want to do a biopsy in the center of that lesion, that's great. I would want to screen for cancer, which is what they'll be doing. And I think I would also want to screen for viral infection, because we now have so many research studies that have implicated Hunner's lesions with infections of the polyoma virus or the Epstein-Barr virus. So I think that's something else that I think would be very interesting, would be to ask for a viral blood test to see if you got any active viral infections going on, because viruses do infect the bladder. And we have multiple studies now that have linked Epstein-Barr and polyoma virus with Hunner's lesion development. Judy said, what is the difference between bladder crystals and uric crystals? Well, uric acid crystals are coming from the kidneys. Now, this is not my area of expertise, so please don't quote me on this. A bladder, so you've got a kidney stone originating from the kidney. You've got bladder stones originating from the bladder. They're forming for different reasons in different parts of the urinary tract. So kidney stones are often uric acid crystals, again, not my area of specialty. They can be calcium, they can be oxalate, etc. Where bladder stones, I think they have a slightly different chemical composition, but I might be wrong. Again, this is not my area of expertise. Keiko says, thank you. I'll look into that. I have ankylosing spondylitis, which is called the cause for SI joint inflammation. My bladder issues started around the same time, though. So the fact that your SI joints are super, super mobile means that your pelvic floor muscles are forced to become very, very tight to hold and stabilize your SI joint. And that tightness is going to affect the bladder with reduced blood supply. So going and having a proper pelvic floor assessment, Keiko, would be the right thing to do. Keiko says, I'm planning to try the lysine you mentioned last time. Yeah, nothing wrong with that. Lori says, I saw an interventional pain management doctor for my SI joint. He injected a steroid under fluoroscopy, which helped the SI joint along with the pelvic pain. Should last 6 to 9 months. Excellent, Lori. I've had that done twice so far. And, I was all worried. I was all so worried about this, injection into my SI joint. Oh my God, it was so easy. I was shocked. I mean, I was in and out in 5 minutes and it didn't hurt at all. Well, there might have been a slight little prick when they put the needle in, but it was just nothing to get upset about at all. So that's great that they're actually working with your SI joint. My SI joint is definitely still problematic too. And it is a result of a injury from playing racket sports, tennis. It is the tennis injury for professional tennis players. I was a professional tennis player in my 20s for just a little bit before I went to grad school. I was okay. I wasn't a top tier professional, but I won a little bit of money in California tournaments, not in national tournaments, which is why I went to grad school. Actually went to college and then to grad school. So Keiko says, I get your steroids into your SI joint every 4 months. It takes the edge off, but it wears off to around the 8 to 12 week mark. My physiatrist didn't want to do a lot of them because there are increased risks, and I'm trying to remember what the risk specifically was. He said he didn't want me to do a lot of them. And I don't exactly remember why. So I've only done 2. And my SI joint's really good, except I heard it pretty badly about a month ago, and I was really struggling to walk without pain for 3 or 4 days. But then sometimes what happens with your SI joint is it gets slightly displaced, and then you're trying to walk with this displaced, and it hurts like hell. And you have to lay on a couch in a certain way and hang the displaced side over the side of the couch and kind of let gravity pull it back into position, which is what I ended up doing to try to get my SI joint back into position. And now, I keep watching this guy on YouTube that teaches these great step classes with great music. And I would love to do that. I love to do step when I was younger, but I would be an idiot to do that now. And I'm sure that all the stepping that I did in my 20s and 30s probably played a role in my SI joint being as messed up as it is. Keiko says, I believe it can damage the tissues over time if you have too many. Yeah, I think so too. I think so too. An interesting study crossed my desk yesterday or the day before, and it was again our U.S. National Institutes of Health MAP Research Network. They're the main IC researchers here in the United States. They use federal money to do that, and they are now they gave the results of using a widespread pain body map to help us identify patients who have central sensitization and widespread pain, phenotype number 3. Because if you've got multiple pain conditions, IC, IBS, vulvodynia, etc., TMJ, migraines, etc., fibromyalgia, We know that our therapeutic target has to be nerves. We know for these patients that bladder treatments are not going to be effective over time. They might gradually reduce some of your symptoms, but they're not going to fix anything because widespread pain is being driven instead by the nervous system, an injured central nervous system. Anne says, how can I stop this burning? And be specific. Where exactly is the burning? Is it in your urethra? Is it on your vulva? Are you struggling with what we call urine burn, where as you're urinating, your urine feels very hot, like it's burning you as it's coming out of your body? You need to tell us exactly where the burning is for us to try to answer that question. Burning in the vagina. So burning in the vagina is going to be one of two, well, it can be three things. The first thing it can be is bacterial vaginosis. As we get older and as we lose estrogen, another thing that happens is pH changes. pH becomes much more favorable to certain pathogenic bacteria. And so for long-term vaginal burning, we want to make sure that you have a vaginal swab so that they can make sure they can at least look at what's living in your vagina to see if you have a pathogenic infection. The second thing we're going to consider with vaginal burning is just very simple estrogen atrophy. Think about how painful dry mouth is. If you've got a dry mouth, you're miserable and you're sipping on water all the time, right? To try to ease the discomfort and burn of that dry mouth. Dry bladder hurts. Dry vagina hurts. And that's from estrogen atrophy. And so if that's happening, the way we ease that is we give that skin what it needs, which is estrogen. When you give that skin estrogen, it produces mucus and it goes from dry to wet. If you're already using estrogen, you need to have your doctor look at your skin to see if you're using enough. I was working with one lady who was like in her early 80s who was only using a tiny amount once a week, which is not even close to being enough to try to help her skin get better. And she kept saying she didn't think it was enough. And I said, well, you absolutely need to go back to the doctor, have them look at your skin, and have them rewrite your prescription potentially based upon what they see. Is there anything to soothe without estrogen? You could buy a vaginal moisturizer. Luvena makes one. We used to sell it. I don't think we sell it anymore. Unfortunately, it tends to have a bit more preservatives and chemicals in it, which can kind of burn a little bit more. Coconut oil, V-Magic, things like that you can put on the outside, not inside your vagina, but on the outside. Soaking in a bathtub with baking soda, soaking in a bathtub with some Aveeno colloidal oatmeal flakes. Anything like that has the potential of calming and soothing that skin. Erin says, hi, Jill. I felt better since using the estrogen cream. Oh, and the PEA you recommended. Thank you. You're welcome. And that would be something that you could consider adding to your routine is some PEA, Peora, which is known for calming nerves down. And that it's the nerves which often drive the burning. And then last but not least, the third thing which can cause vaginal burning is tight pelvic floor muscles. A muscle that's working hard burns. Remember when you were a kid at elementary school and they would force you to go run around the track and you'd get halfway around and your little legs would start burning? Why? Because a muscle that's working hard produces lactic acid that burns. And so I would also want to know if your muscles are tight, because if your muscles are tight, getting those muscles nice and relaxed might be very, very helpful. Paola, where can you buy Peora? Right there, baby. icnetwork.org. Just go into our store. It's on the front page. icnetwork.org. That is a product that I helped to develop. Anne says, I go for pelvic floor and I now have coccydynia. Okay. So Anne, the question that you always want to ask that physical therapist is, are my muscles responding over time, or are they always locking back down into tension? If your muscles always return to tension, especially strong tension, then we have to kind of step away from the muscles and ask ourselves, what puts long-term chronic pressure on muscles but bones? And that's where we would be looking at your hips, looking at your SI joint, looking at your tailbone, looking at your knees, looking at your feet to see if we have any bony structure abnormality. Paula says, how does it help the nerves? Palmitoyl ethanolamide is an endocannabinoid. It's naturally produced in the human body as a pain control method. It's part of our natural pain processing, pain reduction processing. And so the consensus among the researchers is that the reason why PRA works so well is because, or palmitoyl ethanolamide works so well, is because it calms nerves down. It's what I take. And I'm really, really happy with it myself. If I don't take it, my skin gets wonky. It takes several months now. I mean, the nice thing about PEA is the results are what we call durable. So I've stopped it many times. I stopped it again in December because I ran out. I didn't take it for 2 months. And my nerves continue to stay very, very, very calm. So that's what we call a durable response. And then once I start feeling a little pinpricking again, that's usually when I start it again. Oh, I was talking with a friend in the neighborhood. We all got, apparently this new COVID does not cause coughing. What it does is it attacks the back of the throat and it causes pneumonia. And I think that's what I had 3 weeks ago, because she has it now. It's so weird. And so it's like the back of my throat has been injured. And so it's a bit of an effort to talk, to be quite honest. I mean, I can talk, but I can feel my throat going. Hello, Angel. Nice to see you. You have your bladder surgery on February 12th. Awesome. What kind of surgery are you having, hon? Refresh our memory. And Angel says your mom got COVID too. Yeah. Ann says, can you take PEA as needed? It is not expensive. PEA is literally the cheapest supplement we have other than Pre-Leaf. It's under $30 for a month's supply. And if you only take one a day, it would be $15 a month, or less than $15 a month. So I'm very, very happy with Pura. I'm very, very happy. That's the future of supplementation. You're going to see a lot of the bladder supplements now adding PEA to the mix. The new variation of Cystomend is also going to have PEA in it. We just have to sell out of this current production run first to get it. I would like this throat to just like cooperate. I also think that I'm also dealing with long-term throat tension from talking for long periods of time. Because I'm on the phone all day, almost every day with patients anyway. So I probably talk 6 hours a day straight. Easy. Some days 8 or 10 hours. And my throat is saying, girl. Oh, Angel says you're going to take skin off your leg and they're going to make it a bladder sling. Ooh. Angel, would you do me a favor and mail me your mailing address? I'd like to send you a card. And you guys, I got, you know what? Hold on a sec. Let me show you. I don't know if you can see in the background. There is a Pudendal, ironically, a Pudendal nerve entrapment patient. Her name is Atara. I haven't talked to her since COVID, to be quite honest, um, who created the special line of um, um, uh, paintings that she has converted into posters, and she even sent me one of her originals, which I have. Um, I use these all the time. And so I have a bunch of these that I send out. So if anybody needs, you just need an encouraging word, look at this. We will be heard. Look at this. Practice compassion for yourself daily. Boy, isn't that the truth? One of my absolute favorites. Believe in your healing. Calling all angels. And your dreams are worthy of wings. So I have a bunch of these cards that whenever I send, often, if somebody is in crisis or they're having surgery, I will send you a card because I want you to know that you're not alone and we're thinking of you. So feel free, if you have a hydrodistension or surgery, anything like that, go ahead and send that to me. I honestly, I haven't talked to Atara in years. I don't know what she's doing right now. But she's a brilliant, brilliant artist. And what's cool is in every one of these cards is a little thing here. It says, "Dear friend, welcome to Project Angel. We're so happy to have reached you. This angel is one of 30 angels that represent the estimated 30 million American women and the significant but undocumented number of men that live with chronic pelvic, genital, and sexual pain. The angels are here to help us raise awareness about conditions like pudendal neuralgia, vulvodynia, PGAD, interstitial cystitis, endometriosis, pelvic floor, and vestibulitis. Most doctors graduate from medical school without ever having heard the names of these conditions. In many cases, patients are told that their pain and suffering is in their head. Project Angel is unique in that it consists of women who choose to share their stories openly. Our motto is there is no shame in genital pain. We want to ensure that the next generation will not suffer the way that we have. We send you many blessings of health, healing, and hope." And I don't even know, honestly, I don't know if she's still active. Let me look. But anyway, I have a bunch of these and I love to send them out. Her website is not loading here. Let me try on this computer. Hold on. Two different internets. Let me tell you, boy, do I need them. Yeah, it's just not loading. So she may not be active anymore. Brilliant, brilliant, brilliant artist. Does PEA help with back pain? It can, yes. We have a lot of research behind it. Dozens of research studies with PEA and a wide variety of pain conditions. PEA is exceeded everybody's expectations in reducing shingles pain. We had a patient call who was having very, very severe shingles. She asked what she could do. And I immediately went to see if we had any PEA shingles research, and we do. And it even helps with that. So definitely worth a shot. Over the counter, no side effects reported in the IC study and in the great majority of studies. And there are no known drug interactions. All right. So give me your questions. Give me your questions. All right. Hold on a sec. Ooh, kind of scared me there for a moment. I thought I'd accidentally shut down YouTube. Donna says she loves these cards. Yeah, they're just sweet. And it kind of brings up an important point for me. You know what? Let me go get something. Hold on a sec. So, all right. So, 20 years ago, or 25 years ago, when they put me on amitriptyline, oh, here, hold on. Hold on a sec. Hold on. Okay. So, 25 years ago, when they put me on amitriptyline, I had this freaky scary heart reaction. Freaky scary. Amitriptyline is known for changing the conductivity of your heart muscle. And normally your heartbeat is beep, 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 beep. It turned on a third node for me. So my heartbeat became beep, 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 beep. Freaky scary. I had to wear a heart monitor for a month while they were figuring it out. That's why I can't do caffeine. Oh my God, because I still have that. And rather than freak out and get more and more anxious and worried, I said, God dang it, I'm going to do something pretty so that 10 years from now, 15 years from now, 20 years from now, I can say, look what I did when I was scared silly. And what I did is I made dolls. I love to sew. So this is the boy. This was my test doll. But I really loved making doll clothes. And so this is the boy, but this is not, okay. Again, this was the test one. I actually painted on eyes and painted on stuff, right? And the girl wore this little dress. See this little dress right here? Now think 30 years later, I can look back at what was one of the scariest moments of my time. And I'm very, very grateful that rather than just sitting and crying, I just got myself up and said, God dang it, I'm going to make something. She's got 3 skirts, right? So there's a white skirt, and then she's got pantaloons. And I actually ended up entering these in our local county fair, and I won first place. I actually gave the dolls away. I made lots of them to anybody who helped me, things like putting stuff like that. Okay. And so I think it's very important that when you're suffering and struggling, that you keep yourself busy and just do something. Don't sit and watch videos. Don't sit and keep reading scary things on Facebook. Do something. Do something like Atara did with her cards. I mean, Atara was going through the same thing. And what did she do? She painted and made this incredible inspirational series of cards. I did dolls. And this was her hat. That was her hat. I loved ribbons and stuff like that. I'm a girly girl. Okay, so Obviously this year it's been very hard for me, very painful for me. It still is. Death is hard. And so my sister gave me paint by numbers. And I want to show you what I've been working on. It's very big. I've been working on it for a month. Very intricate. I mean, we're talking millimeters of paint. So Kayleen, you know, when I say that I'm going to get off and paint, this is what I'm working on. And there's an inspirational thing here. The letters aren't that. And so I'm going to be able to look back at this and go, okay, you know, I was going through a real hard time. Do something with your hands. And it's not about keeping busy. It's about making new things. It's about making a memory. And it can be something as simple as just making bread once a week and handing them out to neighbors. But don't sit at home and assume that the sky is falling, the world is ending. You'll always live with severe pain. We're trying to figure it out right now. You're doing a good job. You're watching this. You're listening to this. You're reading. That's great. But sometimes you have to turn off the left brain and just let your right brain fly. I quilt. I love quilting. Donna says she does cross stitch. I've done cross stitch. I've done needlepoint. I've done all that. I just love. I have no interest in going on a big fancy vacation. Send me to craft camp. Like the thing I really want to learn now is stained glass. I want to make stained glass. So Eddie says all at once. Just no. I just want to make things. I like to make things. And that's what kind of scares me about where we are as a society right now. Is everybody's glued to their phones and watching videos. And what's going to happen to our craftsmen? The thing is that 10 years from now, watching videos for 10 years leaves you with no memories. I have memories. I can go back now and think that, look at that. I was scared silly. I thought I was, going to have a heart transplant. And I'm able to look back at that time and go, look at what I was able to do. Actually, I made them in this very room that I'm in, which used to be a bedroom. And I had my sewing machine there, So Cindy says, memorize a song. Yeah. Even write poetry. So there's this kid online. His name is Dylan. And Dylan is a foster child. And so what he did during his darkest moments, being in foster care, is he wrote the most amazing poetry. And it's nothing huge. It's just him, Here's one. The boy strolls by the creek, past the field of wild flowers, where he played with his mom in the sunshine for hours. He sits under the maple, where forever she'll stay, and tells her his secrets the same time every day. Because he lost his mom and he went into foster care. And there's one in here. I love this. It's called Let Your Heart Dream. Let your heart dream despite the hate you hear, even when it's hard to conquer your fear. Fight and claw and grind each day. Let nothing stop you or stand in your way. I mean, and a lot of this is just like, listen to this fight. Sitting on wet sand, waves lapping at my feet. I stare across the ocean, wondering the fate I'll meet. Will I be trash forever or one day have it all? Will I kick life in the butt or always fail and fall? Whatever the future brings, if nothing good goes right, through all the crap you want at me, I'll never quit this fight. It's called Poems for my 20,000 closest friend, Dylan. And you can get this on Amazon. He's since had a brain injury. And so he was adopted with a bunch of other foster kids by a family on a farm, and they've gone to college, and they're like doing fantastic right now. But this was the cries of a young boy. And he didn't just, sometimes if you let it all sit inside you, you just swim in it. Strike pen to paper and let the anger out, let the fear out, let the worries out, let it out, get it out of your body. And the way he did that, I did it by running and walking. He did it by writing. Listen to this. Since water costs money, the boy bathes once a week, and his clothes are washed only when they reek. School kids laugh and teachers complain. His fosters just lie and blame the boy again. There's another one. The skinny boy is 9 when he learns how to steal. He knows it's wrong, but his hunger is real. He's afraid he'll be got, but there's no other way since free school lunch is his only meal of the day. Dylan. For 20,000 of my closest friends. You should get this and give it to somebody. People who, are going, you know what, they're doing the woe is me, woe is me. You read the words of a young boy who was thrown into abusive foster care and where he is today and how he developed resilience. She held the bundle tightly until the time was right, then placed it by the station door and vanished into the night. The fireman, with an eerie feeling, opened the door on a whim, and there he found the baby boy who'd be called Dylan after him. Oh, so his mom didn't. Okay, that was one of the other kids. So he was dropped at a fire station, and the firefighter who found him was named Dylan. So he was named Dylan. The boy sits up straight, never dares to touch. He's even afraid to breathe too much. 10 people live there, yet he feels all alone. No matter what they say, it will never be home. Imagine what we could do if we all did something like this to speak about IC, right? So impressed with this. That family, that's why I want to be a foster parent. The family that brought him in and nourished him and gave him the strength to speak. Talk about heroes. They're the heroes. Rhea says, is the calcium in the PEA supplement safe? Sure, why wouldn't it be? Annie says, maybe he can help me fix let's see. Annie says, tomorrow I have a call with a rheumatologist. I don't know how to introduce the subject of IC. Maybe he can help me fix the Pudendal neuralgia problem. Well, rheumatology is focusing on rheumatological diseases, not musculoskeletal stuff. So they're going to be working more with things like Sjogren's syndrome, Zika. So the Pudendal neuralgia, you've got to go to a physical therapist for that, hon. And or a doctor that works with calming nerves down. So you're kind of mixing apples, oranges, and bananas. Can he refer you to a doctor who can help you with the Pudendal neuralgia? Sure. And a book you really should get is, let me get it. Super casual today, my friends. Super casual. I hope you're feeling nice and casual too. Facing Pelvic Pain by Dr. Elise Day. It's free on Kindle Unlimited. It's freaking free. Get it. And so she has, they have different chapters in here. So chapters on gynecological conditions that can cause pelvic pain, et cetera, orthopedic conditions that can cause pelvic pain, neurological conditions that can cause pelvic pain. So let's see what's in her rheumatological group here. So hold on a sec. So it's chapter 10. So what are the rheumatologic, neuroinflammatory, and vascular pain? And so rheumatologic disease refers to medical conditions of the joints, muscles, ligaments, and tendons, such as arthritis or systemic lupus. Many rheumatological diseases present with pain caused by inflammation as compared to pain caused by tight muscles. Inflammation refers to processes in which your immune system responds to any perceived irritant or harmful substance. Inflammation can facilitate the repair and healing of damaged tissue from irritants and physical injuries. But inflammation associated with rheumatological disease is usually low grade and persistent. So, what are the symptoms of rheumatologic diseases? Because the joints, muscles, ligaments, and tendons affected by rheumatological disease are present throughout the body, rheumatological disease can manifest in different ways. Symptoms include fever, weight loss, and fatigue. However, localized signs of inflammation, such as swelling, redness, heat, loss of function, and/or pain, can occur in any body part. Rheumatological disease can present as pelvic pain when the joints, musculature, and other components of the pelvis are involved. And in the context of pelvic pain, symptoms that differentiate rheumatologic disease from other conditions include pain that occurs at night, pain that alternates between the gluteus muscles, improves with activity throughout the day, and is relieved with NSAID meds. Morning pelvic stiffness that lasts more than an hour also suggests rheumatologic disease. So, what rheumatologic diseases can cause pelvic pain? This includes osteoarthritis, rheumatoid arthritis, systemic lupus, Sjogren's, scleroderma, and a group of diseases known as seronegative spondyloarthritis or crystal-associated arthritis and gout. Let's see here if there's anything here. Systemic lupus is commonly associated with fever, joint pain, and a red butterfly rash, which you may hear referred to as a malar rash. Other symptoms include sensitivity to light, kidney dysfunction, neurologic dysfunction in the form of seizures, mouth ulcers that are generally painless, and inflammation of the membranes that line the heart and lungs. Anyway, so that's what they're going to be working at as compared to more biomechanical problems. So pudendal neuralgia is really more of a biomechanical problem. Carolyn says, I have a weak vaginal wall after 6 weeks, just sent me home to do Kegels. No help at all. What exactly does a weak vaginal wall mean? Well, it means that the tissue which normally separates the vagina from the rectum or the vagina from the bladder is no longer stiff. It's weakened for one reason or another. So normally, you know, the let's just say this is the rectum and this is the vagina. They are separate and distinct, and they don't influence each other. But if the vaginal wall becomes weak, what happens is the vagina can push in and create a rectocele. And so that's different from your pelvic floor. That means that the actual structure of the vaginal wall has diminished for some reason. It can diminish with age. It can diminish after you've had children. It can diminish after injury. And so I have a very shallow rectocele, and I can feel it. I mean, I definitely know it's there, and they definitely saw it, but it's not massive. And as long as I'm good with my bowel movements, I'm fine. But if I get to the point where I'm struggling with what I call rocks, you haven't drunk enough water, haven't eaten enough fiber, and you end up getting packing of stool down in your rectum, that can push into the rectocele. So I'm very personally invested in making sure that I have plenty of fiber on board all of the time, which is why I had, for 2 nights in a row, I had hummus, which is made with garbanzo beans. And last night I made vegetarian chili with pincho beans, which I will be having tonight too. Annie says, I already have polyarthritis rheumatoid, and the problems attack my back. I have okay. Yeah, so you're right to be under the care of a rheumatologist to try to calm some of that inflammation down. Carolyn says, how about after uterus removal? Well, again, Carolyn, with aging and the loss of estrogen, we tend to see tissues becoming weaker. Pelvic floor muscles become weaker as we get older. You may notice that when you urinate, sometimes you think you're done and you stand up and you realize you're not done and you sit down and you go again or you stand up again. I call that milking the bladder. That's often a sign that muscles are getting weaker and weaker because of the loss of estrogen. So if it becomes so weak that you're suffering with a prolapse, then they might want to do surgery to do a lift. And somebody was saying here that they're taking a piece of a leg to put in the pelvis to try to correct that prolapse. If a prolapse becomes so severe that the downward motion of stool stops or the downward motion of urine stops, because now we have a big kink in the downward motion, that's when we definitely want to make sure that we can correct some of these abnormalities. And that's when something like surgery is often recommended. Eddie says, I recently purchased PEA 500 bladder rest and bladder builder. I haven't noticed a huge difference with my IC pain levels. What's the best way to take these supplements every day or all at once? Well, Eddie, I would just pick one. You don't need to take all three at once. You're kind of, overdoing it just a wee bit. And so when you're first starting a supplement, it's about finding out what feels good, making sure that you're not having any sort of adverse events with it, which I wouldn't expect with PEA. So what I would do is I would start first with PEA because that's the one that has the best effect at calming nerves down. And see how you do with that for a couple of weeks. And then if you wanted to, you could add a bladder builder or two. That'll give you some chondroitin for the bladder wall combined with the PEA. Bladder builder already has PEA in it, so you could reduce the dose of the PEA to maybe one PEA with your bladder builder. And if for some reason you don't like the bladder builder has probiotics in it that can sometimes flare people. Not everybody, just a small percentage of IC patients flare because of a histamine reaction produced by probiotics. So if you're one of those patients and you feel worse on the bladder builder, then switch over to the bladder rest and it should be okay. But we're all unique and finding what works for us is a challenge. And so there's no way I can tell you what's going to be the magic combination for you. It's about you having to figure out what will work for you the best. And I tend to go, for me personally, I look for the lowest effective dose. I don't take more and more and more. I never do that. I'm not interested in adding more. I want to find the right dose of a specific medication or supplement. As an example, so, I have very mild high blood pressure from caring for my parents. Got it down into normal levels just by losing weight, reducing the salt. I didn't realize that 50% of women who go through menopause develop high blood pressure because our body changes the way it processes salt. And anyway, I got my blood pressure down into the normal range between 125 and 135. My primary care doctor is just a medication junkie. And she's like, I want you on meds. I want you on meds. It's a silent killer. It's a silent killer. And because I was caring for my parents and it was very hard, I said, okay, I'll do a low dose of hydroxychlorothiazide, right? Which really never did anything other than kind of keep me stable. Well, it's a year later. My parents, I'm in a better place. I'm not stressed like I was before. And she wanted me to try a new one. And I'm like, okay. And it was uh, AL, not BU, so ALD, something like that. Anyway, totally screwed my thyroid up. And it brought my blood pressure down into the teens, which I don't think I've ever been in the teens before, ever in my memory as an adult. I've never had my blood pressure in the teens. I've always been in the mid to high 120s. But holy moly, we did the blood test. She goes, "You've got some tachycardia going on. We need to figure this out." Sends me for an EKG. Yeah, atrial tachycardia from the dang high blood pressure med, which I've now stopped. But we did the blood test. My thyroid is so hypothyroid that, oh, so I'm just like, I'm done. I'm done. The cardiologist said I was fine. The ER doctor, when I was there, said I was fine. I'm backing off your meds because I'm not going to screw up the rest of my body right now. I'm in a good place. Wish me luck. Marlia says, I've been using estradiol cream for about 3 weeks, twice a week, and burning is slightly improved. My new symptom is slight arousal, or it feels a little puffy down there. Anyone else experience this sensation? Um, yeah, I mean that can certainly happen. You let your doctor know. They might have you back off to twice a week. Anne says, what are my thoughts on quercetin? Quercetin was the first supplement ever studied for patients who have prostatitis and or IC issues. It has a mild anti-inflammatory effect. You have to be careful with your source of quercetin. A lot of quercetin on the market comes from citrus, and it can be irritating. You've got to get quercetin from a different source. All of the good IC supplements, the Bladder Builder, the Bladder Rest, the Cystoman, the Cystoprotect, they all have quercetin in them because that research is undeniable. Ouch. Lisa says, I recently heard a suggestion to take L-arginine to help relax the tense muscles with IC. Do you know if this is a good idea? I don't know. I okay. I'm having a little nibble of a memory here. Hold on. Let me look and see if I can find the reference I'm thinking of. Hold on. L-arginine contributes to the production of creatine in the body. Creatine is an energy source for the muscles, which is known to enhance strength and endurance. We know that it relaxes blood vessels, thereby increasing blood flow to muscles. So what is L-arginine good for? Relaxing blood vessels, which thereby increases blood flow to the muscles. It doesn't necessarily say that it relaxes muscle tissue directly. Carolyn said, with the weak vaginal wall, are there any other things I should not do to prevent a prolapse? Straining to have bowel movements, big mistake. Lifting weights, big mistake. Those would be the two things that come to mind to really try to protect that tissue down there. Not doing any heavy lifting. Got to be really careful with that. Now you're scared? Why are you scared? What do you have to be scared of, honey? This is part of getting older. It's not cancer. You're not dying. Let's get some context in here. We have tissue that changes with time. I have a mild rectocele from this. Doesn't scare me at all. Oh, you're scared of having a prolapse. Well, so you know what to do. My mom, my mother was crazy And I know that she doesn't mind me sharing this because she believed in the work that I do. So my mom had the strangest bowel habits ever, and I never pushed her on it for years. Because normally you have a bowel movement in the morning after you have breakfast. She always had hers after dinner. And she would disappear into her bathroom for an hour or two with a book. And eventually you'd smell it. She'd have a bowel movement, fine. I never bothered her in the bathroom. I never wanted to know what she was doing in the bathroom. She needed her dignity, even though I was her care provider. And then I walked by and the door was open. And I caught her doing something that absolutely shocked me. She was trying to have a bowel movement. Let me see. And she was doing this. She was straining so bad. She was leaning way back like this, which helped me understand why occasionally I had bowel movements on floors in front of the toilets. I had no idea that she was doing this. And then when she had to use her porta potty, which was next to the bed, I caught her doing it on the porta potty. And as I would just like, stop. What are you doing? Stop. And she said, well, how else do you get it out? You push to get it. And I am sure 100% that she had very severe muscle damage because of what she had been doing for decades. And that's one of the reasons why I'm really glad that she's no longer suffering with that. Because I think she strained so badly that she caused irreparable damage. So bowel movements are not supposed to be difficult. If you're straining, you're not eating enough fiber, or you're not eating enough water, drinking enough water, right? And now I know, now I know why I had such a difficult time in my 20s when I was dealing with my IBS. It was all driven. I mean, a lot of it was driven by tight muscles and nerves. Urination is supposed to be about relaxation. I mean, you're always going to know the health of your pelvic floor by how you pee. If you can sit on the toilet and pee immediately and you pee like a horse, your pelvic floor is good. If you sit on the toilet and you hesitate 5-10 seconds before you can start, and then you're stopping and starting, or your stream goes sideways rather than straight down, that tells us that we've got a mechanical issue going on with your muscles. And when so yesterday, for example, I was thrilled that I peed like a horse all day. I mean, I didn't pee like a horse for decades. I thought it was normal to stop and start. I had pee envy going to stores, and you sit in you go to the bathroom and somebody comes in and they've got this giant gush of urine and you're sitting there dribbling out. Never knew why. Now that my muscles are better, I can actually pee like a horse. And when I can't do that, I know my muscles are getting tight. I go get my wand and I do my internal work. And I'm very proactive about that. Carolyn says, I strained for years to pee and poop until a year ago, a physical therapist said no. Yeah. And part of that, Carolyn, it probably goes back to an old injury for you. I mean, for me, it began after I broke my tailbone in 7th grade. And the ripple effect of that over time and what that did to my health over time, and just not having really good education about it. I mean, when I finally went and saw an IBS specialist like 20 years ago, 15, 18 years ago, somewhere in there. I mean, she was the one who said, and I had very painful poops. I was struggling with a lot of rectal pain. And I was passing rocks, hard stools. They were hard and they hurt. And, she just said, Jill, how many grams of fiber do you? I mean, it was the best appointment of my life. I'll never forget that appointment. She spent an hour with me. And she said, all right, how much fiber do you eat a day? I went, I have no idea. Nobody's ever asked me that question. I said, but I'm sure it's good. I ate a really good diet. And she's like, go home and count it up. You need to eat 20 to 25 grams of fiber a day. I go home, I count it up. I was eating 6 on a good day. It is no wonder that my bowel movements were not normal. And I found a fiber chart online, and I count up my fiber. Now I count up my fiber. I mean, I just pay attention to it. So like yesterday, I probably had, I don't know, maybe 18 grams of fiber, maybe a little less than that. But a couple of days before, I was up at 25. Man, once you start feeling the small rocks happening, you got to up your game. Best source of fiber is green peas, split pea soup. That's my go-to, man. I always have packets of peas in my freezer, and if I just haven't eaten enough, I just throw a pack of peas in the microwave, or peas and carrots in the microwave. 13 to 16 grams of fiber in a cup of green peas. Nancy says, I just want the burning and spasms to stop. I've been taking hyoscine, phenazopyridine, bladder builder, and D-mannose. I need relief. Well, so you're not taking, so if the question, Nancy, is are they pelvic floor spasms or bladder wall spasms? The odds are it could be pelvic floor spasms. And you're not taking anything for your pelvic floor. If you want to calm tight pelvic floor muscles down and you want to ease pelvic floor spasms, you would use a skeletal muscle relaxant like baclofen or Flexeril, or a vaginal Valium suppository. So that would be an interesting experiment. See if your doctor would give you a skeletal muscle relaxant to see if that will calm some of those spasms down. If it's the bladder wall, that's composed of smooth muscle. So you need a smooth muscle relaxant. That's going to be something like ditropan, oxybutynin. The problem with the muscle relaxants is that they're chasing the symptom and not fixing the underlying cause. I look at a bladder wall spasm as the equivalent of your bladder screaming in pain. For people who are having bladder wall spasms, that tells me that bladder wall is very, 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 very inflamed. So I want to know why. Why is it inflamed? Is it inflamed because there's active Hunner's lesions that need to be treated? Or is it inflamed because it's being irritated every day through diet? We need to try to identify the underlying trigger for that inflammation to get that bladder wall to calm down. So that would be the equivalent if you were, for example, drinking a cup of coffee every day or green tea every day, your bladder is going to spasm. It's going to eventually get so irritated from that acid, it's going to start spasming. So here you are, you take an antispasmodic like ditropan to stop the spasm, but you're still drinking the coffee, which is pointless. We've got to get that bladder wall to calm down. We've got to get the pelvic floor to calm down. And so focusing on cause versus effect, and with the pelvic floor, it's about physical therapy. If we get that muscle relaxed through physical therapy, it should stop spasming. So you don't want to just rely on a medication. We want to deal with real, tangible, day-to-day things that we can do that will calm things down. Anne says, I thought oxybutynin was for overactive bladder. It is for anybody with bladder spasms or frequency urgency. And so, yeah. Nancy says, bladder wall inflamed through diet probably. It seems like everything triggers. So if you feel like everything is triggering your bladder wall and giving you problems, we need to know what the health of your bladder wall is. And that's where I would want a cystoscopy to get somebody to look at your bladder to get an idea of what's going on. Hey, let me go microwave this. Guys, take a 2-minute break. I need to heat this up and put some honey in it for my throat. So 2 minutes. If you need to go to the bathroom, go to the bathroom. I'll be right back, okay? Alrighty then. I'm also eating a piece of apple. Okay. Hot water with a little bit of lemonade, honey, and mint. Oh, I don't like strong mint though. Ugh. Let me throw that out. Oh. Only a little bit of mint, not a lot of mint. Let's see, I might have made that too strong. Okay. Gwen said, I started having dribbles after my pee just in the last few months. Normal bladder wall. Is this pelvic floor just got the estrogen cream? Yeah, and it might just be, your muscle. The other thing that happens is estrogen levels drop, is muscles get weaker. So, kind of the dribbling thing is kind of sort of thing. Let your doctor know. We want to make sure that your muscles are healthy. Getting yourself into physical therapy can be very, very helpful. Hello, Boria. The Craft Artistry wrote, so powerful, Jill. I will definitely get Dylan's book. Gwen says, my mom always did laxatives and suppositories due to a pain pill addiction. Yes. Angel said, University of Michigan is the one doing the surgery and they are magnificent. I'm so glad for you, honey. I'm so glad for you. I'm excited for you too, because you're going to be done. You're going to be done. Eddie says, can Hunter's lesions be detected by MRI? No. Not that I know of. Okay, so again with Nancy, sorry, I was chewing on a little piece of apple there. Yeah, too much mint, darn it. Okay. So Nancy said you had a cystoscopy. So you were shown through a cystoscope, you're told, okay, but honey, wait, just hold on one sec. What specifically did they see when they looked in your bladder? Was it normal or did you have Hunter's lesions? Was it red? What did they see? You say he found nothing with a biopsy. So they found nothing else. You had normal tissue in your bladder, right? So if you had normal tissue in your bladder, then what does that tell us? That tells us I also had a completely normal tissue. I had 3 cystoscopies. Every single time it was normal. So let's look at that in a different way. If you have a normal bladder wall, then why are you doing bladder wall treatments? Maybe it's something beyond your bladder, like your pelvic floor, that's driving some of these symptoms. So, have you had a pelvic floor assessment? Do we know what's going on with your pelvic floor? That's an important piece of this puzzle. Okay, and Carolyn said, I was going to ask, urologist said my bladder's fine, but can food and drink irritate the vaginal wall and cause urgency frequency? No. Food does not get into the vagina to cause and trigger vaginal symptoms. The commonality between the bladder pain and the vaginal pain is either going to be tight pelvic floor muscles, sensitive nerves, or estrogen atrophy. So again, have you had a pelvic floor assessment? And what did that find? Because they've looked in your bladder, you've got a good, healthy bladder. Celebrate that. That's exciting. You don't have a bladder disease. That's fantastic news. So our next question is, if it's not my bladder wall, what the heck is causing these symptoms? And that's where we have to look for other things. Tight pelvic floor muscles, Nerve inflammation. Could you have a fibroid tumor pushing on your bladder? Could you have endometriosis attached to your bladder? Could you have pelvic congestion syndrome? There are lots of things that can trigger the bladder and cause these symptoms. And that's where this book shines. This book absolutely shines. Every chapter is really easy to read. It's simply written, and it will go over all of the potential things that can trigger these symptoms. But you can confidently say now they've looked in your bladder, you have a normal bladder wall. That's exciting. But if your symptoms are persistent and you're still struggling with intense pain and intense symptoms, we've got to look beyond the bladder now. We've got to look at muscles, we've got to look at nerves, we've got to look at other things like that. Okay, so Nancy said here, okay, so hold on. Hi, Loretta. Heather uses fennel and peppermint to calm things down. Also, hemorrhoids can cause black stool. That's true. Susan said, what is the purpose of my DRG stimulator? It sure doesn't help my IC pain. It sounds like you had a surgical pudendal nerve implant or sacral nerve implant, Susan. The theory behind that is to try to regulate nerves. They're not approved for pain. They usually don't work for pain. The FDA is very clear on neuromodulation. They're not approved for pain. Doctors should not promise patients that it will reduce their pain. What it can do is it can normalize nerve function. Nancy said it looked like a line. Didn't check that. He said it was not. He showed me a line that indicated a spasm in your pelvic floor spine. Okay, so the devil is in the details here. The devil is in the details. It's often in the weird random symptom that happens that you don't tell anybody about. Like, do you ever have moments when you feel super aroused? Do you ever have pain that shoots down your leg? You are an anatomical mystery to be solved. Could you have endometriosis attached to your bladder, triggering it? Possibly. Could you have varicose veins in your pelvis? If you feel a downward sensation, you feel like you're carrying a bowling ball around in your pelvis and it gets worse as the day goes on, that's a sign that you have pelvic congestion syndrome, which is varicose veins, which can be treated successfully. So your ability to describe your symptoms is important because often there's a weird random symptom that you haven't told anybody about. And that's what we need to know. Do you have pain when you sit down that gets better when you stand up? Things like that. Carolyn said, I was wondering, I have estradiol cream. Pelvic floor therapist said you have a weak vaginal wall. Uterus is removed. No one gives me an answer. Well, you're not looking at this how do I want to say this? It's either caused by the organ, a muscle, a nerve. That's where pain comes from. Because the pain message is transferred via a nerve. The nerves can originate anywhere. The nerves can originate in your bladder. The nerves can originate in your skin. The nerves can originate all over the place. And so I think sometimes you have to simplify your approach here. And we've got to look at the absolute basics here. What is the health of my muscles? What is the health of my nerves? What is the health of my bladder? What is the health of my vagina? And a really good phenotyping would be good for you. If you want to call me this week, or we can go into Zoom and we can try to phenotype you to really try to figure out what group you're falling into. I'm happy to do that. So sometimes we in this meetings going into Zoom so that you guys can talk to me directly and talk to each other. And then I can ask you questions and we can try to phenotype you real time. Susan said, pudendal nerve pain, said Dr. Hampshire. Do I need a bladder stimulator and a DRG stimulator? I have both and neither one is working. Well, Susan, again, this is where we have to simplify it. Number one, they're not working. And if they're not working, why do I still have them in my body? Number two, what do our guidelines say? If you're not responding to therapy, if you're getting worse rather than better, take a step back, revisit the diagnosis. What could we have missed that could also be causing these symptoms? And for pudendal nerve pain, I started out this meeting talking about Dr. Antelak, and I think that because he was the first doctor, really, 30 years ago, to start talking about pudendal nerve pain. And the one thing that he reinforced over and over and over and over and over is if it hurts when you sit, stop sitting down. Get up. You need to have a different chair cushion so that you're not putting pressure on your muscles and your nerves right in your crotch area. And this is where, because what we've got to do is we've got to stop traumatizing the nerve. When we stop traumatizing the nerve and we give that nerve time to calm down, time to heal, then the nerve will calm down, things will get better. But if we keep tweaking and forcing that nerve by putting all of our weight on it when sitting, the nerve will never get better. And so this chair cushion, this is the chair cushion for pudendal neuralgia. You can get this in the ICN shop. It's got a groove down the middle. So each butt cheek is supported, but nothing is pushing up into your crotch area. So nothing's going to hit that pudendal nerve. And so that would be what, you've got to make sure that you're not tweaking that nerve more. The nerve is, Carolyn, the phone number is right at the top of our website. Just go to icnetwork.org and you'll see it right there. It's also on the poster back there. You can try calling. My phone is first come, first serve. And just know that I usually answer phone calls if you've had to leave a message later in the day. Because I have a ton of work I've got to do too. So, there are times when I just have to rest my voice. Carolyn says, I feel inflamed like a hot scalding, but I do not burn when peeing. It comes and goes. Okay, so again, that scalding sensation is coming from nerves or muscle. It's that simple. So we got to look at what is the health of my skin down there and what is the health of my muscles down there. I've been there, girl. I have been there. I've had hot and scalding urine. That's often a direct sign that the skin is just compromised from estrogen atrophy. Cindy said, PR really helped me with bladder pain due to inflammation. I recommend it. Great. Does anybody want to go into Zoom? I mean, the 49ers football game starts in 25 minutes. I am a 49ers fan. I am going to want to watch that. Susan said, honestly, I don't even think it's a pudendal nerve. I just think I've been misdiagnosed, even misdiagnosed with IC. So you're at a loss right now. Well, Susan, why didn't you come into Zoom? Let's talk. Let me start up here. I'm going to start up the Zoom meeting right now. And so here, hold on a sec. Where is Zoom in my... All right, hold on one sec. Let me just... Oh, do not do this to me. Let's see if it logs me in. Again, I had everything turned off. Everything was unplugged. Okay, so here we go. So I'm starting the Zoom. And let me Okay, so here. Okay, we're not going to do a long Zoom meeting, but I'm happy to do it. All right, there's your Zoom invite, Facebook, and let me give it to YouTube too here. Hold on a sec. Actually, I have to email it to myself first. All right, so I'm emailing it from this computer to this computer. So give me one sec. You know, I never felt old until this year. I mean, I feel young at heart, but I cannot deny that this body has taken a beating this year. I cannot deny it. It is real. All right, YouTube, I'm going to give you the link. All right. So YouTube has a link. Facebook has a link. Give you guys 5 or 10 minutes to come in. If nobody comes in, we just won't do it, and that's fine. But I'm giving you that offer. Here, hold on a sec. All right. Oh. All right, we've got one person that's come in so far. And Paula, just mute your microphone for now. Okay, hon, let's just let people come in. All right, so any more questions? Any more questions? Marlia says, oh, Susan says, how do I get into Zoom? I just put the link there, hun. Just click on that link. All right, we've got Susan's coming in, John's coming in. Marlia said, oh, how I hate toilet paper. I use a peri bottle after urination, but still need to dry off. Dry, but toilet paper seems to be irritating. I've tried lots of different brands. Honey, just use a washcloth. Use a dry, soft washcloth. I mean, you've already used a peri bottle to rinse all the urine off your skin. And so you're clean. You're just drying off. Just use a washcloth. And just swap it out every other day. I mean, because you're not actively drying up urine. You've already rinsed it off. And that will be good. Nancy's coming in. Okay, so for you guys in Zoom, so let me, we've got two options here, and I'm going to let the people in Zoom decide. So if you're in Zoom right now, mute yourself, please. Barbara said, how do we get to Sesame Street? They never did tell us. Okay. So sometimes I leave Facebook and YouTube open so people can listen to you, but they won't see you. Nobody will see you in the Zoom meeting except other people in the Zoom, only if you have your camera on. When you're talking to me, I would please ask you to have your camera on so I can see your face. If for those of you who come into Zoom, you would prefer that I not do that, that's absolutely fine. We can turn off Facebook and we can turn off YouTube because basically we don't really have questions so much anymore coming in. So YouTube guys, tell you what, so for those of you on YouTube, thank you so much for coming. Really appreciate it. You can come into Zoom. Love to have you come into Zoom. I'm going to shut down the stream for YouTube now. And I will see you guys on YouTube next week on Sunday. Knock on wood. Okay? So we're going to shut down YouTube.
Hello.
Yes, I know, but don't say